Hello, everyone. My name is Pi-Ming. Now I want to share your PowerPoint. So start my presentation. Today, my research topic is path analysis, testing the development of the personality and the psychological well-being model. I'm Pi-Ming at the nursing department. My co-author is Dr. Gavin at the Department of Mathematics. The purpose of this study was to using path analysis to test the development of a personality and psychological well-being model. The draft of framework. A person's personality was shaped by the biological temper, family interaction, cognitive learning, these three main factors. And different personality, when they face the stressors, they will choose the different coping strategies. And the outcome will be psychological well-being, suicidal ideation, anxiety, and depression. And the spiritual well-being is the mediator during this process. Introduction, the anxiety disorder are the most common mental illness in the United States. Affect 40 million adults age 18 and older. Nearly one half of those diagnosed with depression are also diagnosed with the anxiety disorder. The prevalence of suicidal ideation among young adults, young adults, was higher than the adults aged 50 years older or older. The prevalence of suicidal ideation was high among adults with the major depression, adults with both major depression and substance abuse, and also the people with the mental illness but didn't receive the treatment. Older adults whose parents used the child monitor, inductive reasoning, communication, involvement, and positive family interaction had a lower score of anxiety and depression. Older adults whose parents used inconsistent discipline, harsh discipline, and negative family interaction had a higher score on anxiety and depression. Lack of a good family environment has been identified as an important risk factor for mental illness. People who have been physically or sexually abused, those who have been forced to use drugs or alcohol by their family were more likely to develop mental illness. Older adults who had a higher score of spiritual well-being, higher score of faith, belief, life and self-responsibility, and the higher score of life satisfaction and self-actualization had the lower scores of anxiety and depression. The definition of spiritual well-being is generally considered to be the search for meaning and the purpose in human existence, leading one to strive for a state of harmony with oneself and others, while working to balance inner needs and the rest of the life of the world. Significance of this study. Most family interaction study focus on the college student, adolescents. And a few study examine the long-term influence of parenting among older adults, psychological well-being, and suicidal ideation. So in this study, we will focus on this model. And research, I have 4 research hypotheses. First hypothesis is family interaction and spiritual well-being had statistically significant relationships with the development of a person's personality. The second hypothesis, a person's personality had a statistically significant relationship with selecting coping strategies. The third hypothesis, using different coping strategies, had a statistically significant relationships with the outcome variable, including psychological well-being, suicidal ideation, anxiety, and depression. The math. This is cross-sectional descriptive design. The IRB has been approved. Questionnaires were used to do the data analysis from community elderlies in the United States. Participants, there were 448 participants, older adults, recruiting from the living in the Midwest community in the United States. The mean age is 71.3 and 184 were male, and there were 264 female. Data was analyzed by SPSS version 23 and the PATH analysis. PATH analysis was used to examine the model and hypothesis. PATH analysis is a form of multiple regression statistical analysis that is used to evaluate causal models by examining the relationships between the dependent variable and independent variables. By using these methods, one can estimate both the magnitude and the significance of the causal connections between variables. An SEM model was developed and the PATH analysis was performed using an R package called Levin, and graphics were produced using the R package called SandPlot. This table shows us the instruments' internal consistency reliability. You can see the red color, that is the internal consistency reliability, compound alpha. Generally, the compound alpha should over than 0.7. That means they have a good internal consistency reliability. In this study, only the this subscale is family interaction negative subscale, and the coping strategy using the emotional coping, the coping 3 and 4. These 3 subscale lower than 0.7. Others instruments were above the 0.7. In general, this is good instruments, internal consistency, reliability. In the coping strategy, there are 4 coping strategies in this study. So I want to introduce a little bit about these coping strategies. Coping strategy 1, we call problem-focused engagement. And the example question is, I try to let my emotions out. I try to talk about it with a friend. I let my feelings out to reduce the stress. And then coping strategy 2 is problem-focused disengagement. Example question including, I make a plan of the action and follow it. I look for the silver lining or try to look on the bright side of the things. I tackle the problem head on. I step back from the situation and try to push things into perspective. Coping strategy 3 is emotional focus engagement. The example question is, I hope the problem will take care of itself. I try to put the problem out of my mind. I hope for a miracle. I try not to think about the problem. Coping strategy 4 is emotional focus disengagement. Example question is, I try to spend time alone. I tend to blame myself. I tend to criticize myself. I keep my thoughts and feelings to myself. The results. The first table is to solve the hypothesis 1. So we can see the negative family interaction has the significant negative relationship with personality. So the negative family interaction score increasing, and then the personality, the score will decreasing. And increasing the personality score means they have more positive personality. So next two is the positive family interaction and spiritual well-being have the positive significant relationship with personality. So increasing those score will increasing the personality. This is the previous we talk about hypothesis. So table 1 solved our first hypothesis, family interaction and spiritual well-being and the personality relationship. The second table is talk about is for the hypothesis 2 and hypothesis 3. Look at the first first column is personality, the relationship with the problem focus engagement and the emotional focus engagement. The red color means they have a statistical significant relationship. So we can see in this table only one no significant relationship. Others all have the significant relationship. Our second hypothesis is the personality will have the relationship with the coping strategies, and our results will have the significant relationship. When the problem focus engagement or disengagement score increasing, also the personality score also is the higher. Emotional coping strategies and disengagement, these two has negative significant relationship with personality. The third hypothesis is the using different coping strategy will have a in relationship with the outcomes variables. And we can see the increasing using the problem focus coping strategy will increasing the score of the psychological well-being also increased. Using the emotional focus coping strategies, the participants' psychological well-being score also will decrease. Okay, so negative relationship. But if they use the emotional focus, this coping strategy will increasing the score of suicidal ideation, increase the anxiety, and increase the depression score, also increase. So they have positive relationship with the emotional coping strategies. But problem focus coping strategy will have the negative relationship with suicidal ideation, anxiety, and depression. So the table two is related to the second hypothesis, talk about personality and the coping strategy. Also explain the third hypothesis. So it's coping strategy and the outcome variable relationship. The third table, including 4 table, this is hypothesis false. Because we have 4 coping strategies. So using the different coping strategies, the relationship between family interaction, spiritual well-being, and the outcome variable, we can see not every factors in family interaction has significant relationship, but you can see the spiritual well-being has the significant relationship with psychological well-being, increasing the score of spiritual well-being. The psychological well-being score also increased. The spiritual well-being score increased. The suicidal ideation, anxiety, and depression scores were decreased. So this is the coping strategy. This is false hypothesis. And we can see using the second coping strategy, the model, from the family interaction and spiritual well-being, the relationship with the outcome variable. Also, spiritual well-being all have the significant relationship. And also coping strategy 3, and the outcome variable, and family interaction and spiritual well-being. Spiritual well-being also has the significant relationship with all of the outcome variable, and the false model also. And this is I use a figure to describe how is the relationship from family interaction, spiritual well-being, and the outcome variable. Okay. So this is for our false hypothesis. And this is the path analysis model using the coping strategy 1, problem focus engagement. And we can see all the variables in this model. Okay. And this is developed by Dr. Gavin Waters. Gavin Waters, he did the path analysis, and this is the model. Okay. And also coping strategy 2, the model. And we already explained each of them from table 1 to table 4. So we already explained all of this figure. Okay. So limitation in this study, the convenience sample may limit the generalizability of the findings to older adults in the United States, and causal relationship among study variables cannot be determined due to the nature of the cross-sectional study design. So maybe in the future, we can use the experimental or longitudinal research design to improve. And because we asked the older adults about when they were little and how is the interaction between the older adult and their parents. So the long-term memory may impact the results statistical significant. Few questions cause the low internal consistency reliability in the 3 subscales. Conclusion, this study contributes the literature review, the literature gap on these 4 hypotheses in this study. The implications of this study are providing a comprehensive model of personality development and psychological well-being for mental health nursing professionals. This study has indicated there are strong relationships among these variables in this model, especially for the variable of spiritual well-being and problem-focused coping strategies. So in the future, for nursing education can conduct spiritual group activity and teach the problem-focused coping strategies. I want to express my sincere gratitude to Missouri Western State University for support this presentation. My appreciation also goes to all the participants. And thank you very much for your attention. Any question? Thank you. I end my presentation.